Hi, hello, Vanika. My name is Sanklon Tanglela, and I will basically be going through six different exercises and they planes of movements. We'll be looking at types of muscles that are activated, what state they're activated in, as well as different types of joints, as well as planes of movements and axes of movement. Hello, sorry, this is my volunteer Sam, and today we'll be starting with the first exercise, which is a shoulder external rotation pulley with a pulley machine. We do not have a pulley machine here, so we'll be doing it manually. So, can you start? So, the first thing we'll be looking at is the plane of movement. So, as you can see, it's going across, abducting from the body, which will then put it in the collateral movements. Please excuse my pronunciation, I do struggle with it. Next up, we're moving with the axle of rotation, and as we can see, it will be sagittarial. The axle of rotational will be sagittarial. Next, moving on to the types of joints. As we can obviously see, it will be a ball and socket in the shoulder joints and a hinge joint in the elbow. The types of movement that they'll be doing is abducting and adducting from the body, or adducting and adducting, adduction and abduction, as it moves away from the body and to the body. Next will be the type of muscles that are activated. So the two muscles that are activated, the muscles that are activated is the teres minor and major, which will be found here underneath the armpit. Sorry, could you think? So we'll be stretching across from the scapulothoracic to join up with the humerus. Next up will be the deltoids, which will be the middle deltoid and the posterior deltoid, found just up on the shoulder, and those would be those are the muscles that are being activated in this action. Next up will be what type of movement it's making, and it will be isometric on the biceps, as well as isometric on the bicep femoris and the tricep femoris. Next we'll be looking at lat pull downs, which are, as my volunteer so gracefully demonstrates, this plane of movements will be sagittarial, and the axis of rotation will be frontal. The joints being used will be a ball and socket and scapulothoracic. The movements in which these joints will be doing is, as well as a hinge joint in the elbow. The hinge joints in the elbow will be flexing and extending, as well as the shoulder joints, the ball and socket in the shoulder will be adducting and abducting, and the scapulothoracic will be abducting and adducting. Thank you. And the muscles that are being utilized here will be, the muscles being used will be the biceps, and the deltoids, as well as the scapulothoracic which will be moving up and down, as well as the latissimus dorsi, which will be found here in the back, and it will be contracting and concentric and eccentric. Yeah, thank you, and go. Next plane of movement exercise will be the push-up. So as he goes down, we will see that the plane of movement is sagittarial, and the axis of rotation is frontal. So as he goes up, we can see the joints being used is a ball and socket, the hinge joints, as well as what can also be described as the hinge joints in the wrist, as well as the scapulothoracic. So as he goes down, there's a flexion. As he goes down, there's a flexion in the elbow, in the elbow and the ball and sockets. The scapulothoracic comes together, and as he goes up, the opposite happens with the elbow joint extending and the ball and socket extending. The scapulothoracic does the same as well. There is the muscles that are being utilized are the biceps, the scapulothoracic, and the triceps, as well as the delts. In some siblings, also the pectorals. We'll be looking at the types of movements that the bicep and the tricep do. They usually act in tandem, with the bicep contracting in the downward motion and the tricep extracting. They then follow the they then you and then act in opposite to each other, with the tricep contracting in the upward motion and the bicep extending. The next movements we'll be looking at is the squat, and the squat happens in a sagittal plane of movement, and the axis of rotation is the frontal axis of rotation. The joints being utilized is a ball and sockets in the hip, a hinge joint in the knee, as well as a hinge joint in the ankle. So as he goes down, the hip and knee joints flex on a flexion movement, and the hinge joint, the ankle dorses. As he goes up, the vice versa happens, with the hip and the knee joint extending, and the ankle planting. The muscles that are being utilized in a squat are the muscles being utilized are the hamstrings and the quadriceps. In the hamstrings, we have the bicep femoris, as well as the gluteus maximus up here. The gluteus maximus sits above the gluteus minus, and it's mostly in the buttocks area, and the bicep femoris will be found here. This side we'll be looking at the hamstring with the quadriceps, which contract the knee. During a squat, we experience eccentric of the hamstrings and concentric of the quadriceps, and vice versa with the opposite action. Next up, we'll be moving on to a side lying hip abduction. This exercise plane of movements will be apologies for that. The plane of movements in this exercise is coronal, with the axis of rotation being sagittal. So as we start, the joints being utilized is a ball and socket in the hip joint. Yes, the ball and socket. The muscles being used are the movements of the joints of the hip joints is abduction and adduction. And then we'll move on to the muscles being so the muscles that will be used will be the gluteus medius, which is also found near on the buttocks area, and please excuse my pronunciation, the tensius velleius latae. I do apologize for that, but that will be found here, and it stretches across to the knee, pulling the whole leg up, abducting it from the body. The next exercise will be a Russian twist with a medicine ball and feet in the air. However, we do not have a medicine ball. The moment of rotation, apologies, will be transversal, which is the rotation of the hips, as well as will be transversal. The axis of rotation will be sagittal, and the different sockets used in this exercise will be the ball and socket joint. Apologies, the joints used be the ball and socket joints, as well as the knee the knee joints, which is the hinge joints. Uh, the action of the joints that is shown here will be a rotation of the hips and flexion of the knee joints, as well as the ball and socket hip joints. Next up will be the muscles that are used in this exercise. The muscles will be, first up will be the abdominals, so the obliques, outer obliques, inner obliques, and the abdominal muscles, more commonly known as the abs.